N95 respirators are meant to be single-use and then discarded. However, during this pandemic, the CDC has authorized the extended use of N95 respirators. The NIH has also shown that 3 different methods for sterilizing N95s are both effective and safe without degrading the quality of filtration of the respirator. We are using the hydrogen peroxide method. In order for your N95 to be sterilized and reused, we ask all providers to wear no facial makeup below the eyes, no perfumes, colognes, or strong aftershaves, and not to write on their N95. So we started off with some basics. We then did some deep dives into new protocols and emerging science, some new technologies for reprocessing N95s, and now we're going to go back to the basics and review common errors in personal protective equipment. Now let's talk about shoes. In order for shoes to be clinic appropriate, they must be closed-toed, closed-footed, and closed-heeled, so that if an instrument were to drop on your foot would be protected. One option is clogs. However, not everyone is into the fashion statement that clogs set. The good news is there's lots of other good options. Here are 3 examples. In the upper left and upper right, we see 2 different styles of ankle boots. On the lower image, we see a sneaker made out of a thick canvas. In all 3 options, we see that the toes, the foot, and the heel are covered. These examples are a little bit deceptive. While the toes and the heel are covered, the top of the foot is not. Therefore, if a dirty instrument were to fall onto this person's foot, it could cause a puncture wound and a Sharps injury. Hopefully it's clear that these 2 examples are not appropriate for clinic. However, we wanted to make sure everyone was on the same page. The best kind of gown to wear in a dental environment is one that is long-sleeved with a wrist cuff, goes down to the knees, ties in the back, and is water-resistant. One of the challenges in wearing a shorter coat rather than a knee-length gown is that when the provider sits down to perform a procedure, the top of the thighs become exposed to saliva, droplets, and spatter, thereby contaminating that area. In addition, having buttons or ties in the front of the gown or the coat make it very challenging not to contaminate oneself when doffing the gown or the coat. Another common error is when a gown is worn, but it is not properly affixed or tied behind the neck and the waist. The last common error with gowns is wearing them where they shouldn't be worn. Gowns are meant to be worn only within the clinical area. That means where care is being provided. Gowns should not be worn in any areas where food is being consumed, should not be worn in faculty or resident offices that are not being regularly disinfected or where food is allowed, and gowns should not be worn into any restrooms. Now let's talk about masks. Masks are meant to fully cover the nose and mouth. Sometimes we see people wearing masks where it's covering the mouth, but it's dropped down a little bit so the nose is not covered. Sometimes people let it drop down even further and hang out on their chin, where it's covering neither their nose or their mouth. This offers very little protection. Another common error in wearing masks is twisting the ear loops before wearing the mask. For people who have small faces, this might make it feel like the mask is feeling more snug. However, it creates outpouchings on each side, thereby allowing entry of potentially infectious material. Sometimes we forget that we also have to protect our eyes from particles and potentially infectious material. For those of us who wear eyeglasses, sometimes we add on these flimsy plastic disposable side shields. And while they're probably better than nothing, they really don't offer adequate protection in the field of dentistry. The good thing is there's lots of different options that do. Here we see some loops that have solid plastic side shields that fit right up against the lens. These are totally acceptable. In addition, we have disposable goggles that fit over eyeglasses, we have solid safety goggles, and we have a variety of face shields. All of these are appropriate. Finally, let's talk about common errors with wearing gloves. First, let's talk about hand jewelry. Hand jewelry can harbor microbes, and in addition, some styles of hand jewelry can tear gloves while the gloves are being put on or removed. In addition, once we put our gloves on, really the only things we should be touching are our instruments and our patient. We should not be adjusting our loops, our loop light, our masks, or our glasses with our gloves on. Gloves are the last part of PPE to be donned and the first part of PPE to be doffed or removed. It's now time to move on to your second self-assessment.